Hi, I'm Lynn Schulte, a women's health physical therapist, pregnancy and postpartum recovery expert in the Denver and Boulder, Colorado area, and I am the founder of the Institute for Birth Healing.
So I want to explain to you what happens to your pelvis during the birthing process to get the baby on through. And so I'm just going to talk about what happens to get the baby on out the pelvis. Your pelvic bones need to widen out to the side and the sacrum needs to lift backwards in order to create more room for the baby to come on out. And sometimes the baby comes out more with pressure more on the right side, or maybe more on the left side, or it really opens up and now your pelvis is stuck in this open birthing pattern. And so you may feel that when you go to sit, you don't sit as evenly as possible as you used to. You may notice that you have more pelvic pain or low back pain. You may feel discombobulated, ungrounded. Those are all things that can happen to you when you have this open birthing pattern in your pelvis. Your pelvic floor muscles are really weak with this open birthing pattern because they are on stretch. You might have pain with intercourse. You might have prolapse or heaviness in your pelvic space. And so this may help with some of that. Let's see, I think that's all that I can think of. Pelvic pain, back pain, just the heaviness, the downward pressure feeling in this area. When these bones are out after birth, some women actually feel like one side of their pelvis is in one room and the other side of the pelvis is in another room. That is a sign that you want to do this exercise to help close up your bones. So the reason we don't want to walk around like this is because our pelvis is way more unstable in this open birthing pattern. This is not how we're meant to function. But after birth, these bones can get stuck in this position and they don't come back together on their own. So doing this exercise can really help to close up those bones and get them back into their normal position. And then all the muscles that attach to this pelvis is going to work so much better, including your pelvic floor muscles. So if you find that your pelvic floor muscles you can't get them to contract very well, you may want to try this exercise first to help bring the bones back into their normal position, and that may activate those pelvic floors to be able to work better for you, okay? So if you're having any of those issues that I talked about, please give this exercise a try and see if it helps you out. Now, when you do this exercise, it's really important that you don't create pain. If there's any pain, that's a sign that things are not happy, that something's in dysfunction, and we don't want to continue on. So if you're having any pain while you're doing this, there's two directions we're going to do the exercise. We're going to squeeze our knees together and we're going to squeeze our legs apart. And so we're going to start with our knees coming together. If that creates pain, stop and go the opposite direction first and see if that creates pain, then stop. You need to go see a practitioner. Please go see one of my birth healing specialists. I have a directory on my website. Please check and see if there's someone near you. Or you could go see a pelvic health physical therapist. They can help you out as well. So you don't want to create any pain while you're doing this. If you're creating pain while you're trying to squeeze your knees together, stop and try to squeeze your legs apart and do the 3 positions apart, and then go back to the together position and see if that has lessened the pain or maybe hopefully eliminated the pain for you. And so try the different positions first, but if both positions create pain, please go see a practitioner that is telling you that this pelvis is not happy and it needs help. And my pelvic floor, my birth healing practitioners know how to help you out the best in getting your pelvis come back together. So please check out my directory. So what do? It's nice if you have a partner to do this with you so that you can just stay relaxed and you can just focus in on activating your legs, and then the partner just provides the resistance. So the first thing we want to do is we're going to try to squeeze the knees together. You're going to put your partner's going to put their fist between their knees, your knees, and you're going to try to squeeze your knees together as hard as you can for 10 seconds. So count out loud with your partner for those 10 seconds. We'll say 7, 8, 9, and then you relax. And then your partner's going to put 2 fists between your knees, and you're going to squeeze again. And as hard as you can, squeeze, 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 squeeze. We'll say 7, 8, 9, 10. Then we relax. Then your partner's going to bring their forearm in between your 2 knees, and you're going to squeeze their forearm together. So squeeze, squeeze, squeeze as hard as you can, again, without creating pain. Okay? 7, 8, 9, 10. Now let's say you did that and you did the first one with 1 fist and that created pain. I want you to stop and go directly to this one and do this in 3 positions and then go back to it and see if it's still painful or not, okay? So you've done the 3 positions squeezing together. Now we're going to do 3 positions squeezing out. So we want to keep the knees somewhat together, and we're going to just resist the outward motion. So squeeze out, push your knees apart as hard as you can, and your partner is keeping your legs in this same position. We're not allowing you to move. It's not about moving your legs. You want to keep the legs in that same position. So resist, push, push, push as hard as you can, harder, harder, harder for 10 seconds, and then relax. And then we're going to open up the knees a little bit farther, and then we're going to resist outward. So again, do you see her legs are not moving as she pushes, pushes, pushes as hard as she can for 10 seconds. And then we're going to do even further out. And what I like to do if I'm the partner is I will have them rest their knee into my belly, and I need to contract my belly so it doesn't hurt my abdomen. And then I use my hands here, reach as far as you can, and now push apart, push hard, 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 hard as you can for 10 seconds. Really push. We need the force of those muscles to help move those bones back together again. And you do that for 10 seconds and then you relax, okay? And doing both directions, inward and outward, is what's going to help bring those bones back to the midline, back into their normal position so things can function better in your pelvis, okay? So again, please do not create any pain. If you create pain in one direction, if you create pain squeezing, move to the outside and do the pushing apart exercises. If that creates pain, stop. You need to go see a practitioner. You need more help. If this is not painful and doing the separation apart is good, then do that first and then come back and try the squeezes again. And if that's not painful, then do the squeezes in those 3 positions then, okay? So I hope that makes sense. Give this a try. Reach out if you have any questions about it, or please go see one of my birth healing practitioners because they can really help you get your pelvis and your pelvic floor muscles working into their optimal best after birth. Okay? Thanks so much, and please give that a try.
If you're a practitioner, closing up the pelvis is one of the steps in my 6 key assessments for a stronger pelvic floor muscle contraction. Download it now by clicking on the link in the description of this video to see if you're doing them all. Thanks for watching.